were submitted as of last night. We didn't have more questions submitted today because we didn't post the question box because there were a lot of questions already. So only a dusting, Julia. Where are you? Because here it was. Well, actually, we're in this part of Connecticut. My 16-year-old is a weather buff. He kept measuring it last night. We got 8 inches total. Kalamazoo. Oh, that was you in Kalamazoo. That's right. Snow in Indianapolis, but not enough for a true snow day. Isn't that funny? Because you guys are freezing cold there. And by the way, we are going to touch upon the COVID, but there have been a lot of discussion from all of our governing bodies. Jenny and I haven't even gotten to talk to you about it. American College of OBGYN, Society for Reproductive Medicine, Society for Maternal Fetal Medicine, all coming out saying, actually, I think a really nice metered statement about the vaccine, about its likely safety, about the fact that pregnant women can get it, but they should not be pressured and that we should respect either way, which I actually thought was really nicely said on the part of the people in charge, because it wasn't kind of that like dogmatic pregnant women should get it. It was shared decision-making, which is really how everything should be. Right?
Absolutely. And it's funny, you and I have not talked about it, but I actually have, because of an organization that I volunteer with. They just sent an email yesterday saying that all of us volunteers are eligible for the vaccine. And I was like, do I want to get it? I don't know.
Maybe you should ask your doctor and we should share a decision. Wait, yes. What organization is that?
Silver Hill Hospital.
Oh, yeah.
Yeah.
I forgot to read them.
Yeah. So even though I'm not really on campus, I think they're just offering it to everyone that does work for the hospital. And so I was like, I don't know.
Right.
It's like
we can talk about that at the end. This will be like a true live, like patient-doctor discussion about it.
Yeah.
We'll see.
Yeah.
All right. It's almost 7:30. So that doorbell ring is so funny. Almost 7:30. So we're going to start soon.
I know. I actually thought I turned that noise off.
Thank God you know how to do all the Zoom stuff, Jenny.
No, but clearly I don't, because right now I'm like, how do I turn the noise off? I thought I had already, but okay. If anyone knows how to turn that ding noise off.
Yeah. And anyone who is trickling in now, as always, we never know how many people are really going to show up. We had 77-ish people register. We're obviously not going to wait for all 77 because we're just going to start at 7:30. Welcome everybody. Hi. For those of you guys who don't know me, I am Shieva Gofrani. You probably know me from Instagram because I assume that's how you got here, but you might have gotten here from Jenny's Instagram. Shieva Gofrani, OBGYN, 21 years. Love to do this, exhausted from doing this, but it's a great gig. And my business partner, Jenny Lynn Hayes Edwards, who is a holistic nutritionist and the co-founder with me of Tribe Called V. So that's our kind of newer side gig. And we're going to talk a little bit about that at the end. But tonight we want to talk about pregnancy, trying to conceive, anxieties with pregnancy, specific questions. So we had posted in that question sticker and you guys submitted your questions. And Jenny, who is the operations person of our gig, printed them for me. So we're going to talk about that. And as you guys log in, if you want, just give us a hi, I'm here. This is where I'm from. I'm pregnant or I'm trying to conceive. You can put in questions and we'll try to get to them. But I just want to honor the ones that people had sent in yesterday dutifully. So without further ado, Jenny, do you want to add anything before we get started?
No, I'm just excited. I figured out the ding. I turned the ding off.
Good.
And very excited to be here and be chatting with you and all these fabulous ladies.
All right. And were there any details about muting and stuff like that they need to know?
Well, just little housekeeping. Everyone is set up to have video and because this is not a webinar, this is a Zoom meeting. So the difference is that so just everyone's set to be muted and video off just to have some anonymity for all of you because we are recording this. But any questions you want to put in, throw them into the chat. I will take a look. We're going to go through these questions and definitely we have a little treat that we want to offer everyone at the very end. So we hope that you guys stick around to the end. We're going to honor everyone's time and close this right at 8:30. But we hope that you'll stick around to the end because we do have quite a few people that are trying to conceive, quite a few people that are already pregnant. So we want to address, all the questions for where everybody is in their journey.
Right. So Jenny's going to kind of moderate and just let me know where we're at, but the general flow is going to be, we're going to talk first about trying to conceive, then about first trimester, mid trimester, the COVID, some of the third trimester stuff. There's obviously so much to get to. We're not going to get to everything, but we'll try to honor these questions. We'll try to answer more questions. Like we said, we're going to tell you about what we're doing after this. And thank you guys for all coming on and doing this. Really, like anyone who knows this, knows I get weepy every time I see people show up because I feel like you're showing up just to see us talk. It's so great. All right, let's start. Jenny.
Let's start.
Wait, and by the way, I'm sorry, we should say one more thing. Jenny, my business partner, is also 30 weeks pregnant.
31 as of
31
yesterday.
weeks pregnant. And my patient, I should know that, 31 weeks.
She's the size of a coconut, which is, I happen to like the fruit this week.
All right, conceiving.
Yes, conceiving, because that's a big one for a lot of people that are struggling with it or just want some general advice. So let's talk about all things conceiving, ovulation kits, various things.
Right. So I'm looking at these questions. So basically, I'm going to give you guys a quick lowdown again about your cycle, because I find that even my most educated of women do not know this. Not everyone ovulates on day 14. People ovulate 14 days before they get their period. So for example, if you have a 28-day cycle, you happen to ovulate on day 14. And the first day of bleeding is called day 1. If you have a 32-day cycle, then what day do you ovulate? Jenny, you've learned this math.
18.
18. All right. And if you have a 29-day cycle, you ovulate on day 15. So in other words, you can never predict exactly what day you're going to ovulate. Those ovulation monitors and your apps can kind of average things out, but you'll never know exactly. It can vary by 1 to 2 days per cycle. That matters because the sperm can last actually maybe up to 5 days, but the egg can probably only last 1, maximum 2 days. The other problem is that the ovulation kits, I find, are fraught with inaccuracies because they're detecting the LH surge, which is the hormone surge that happens 1 to 2 days before you ovulate. So let's say you see that surge and you only have sex that day or the next day. There really is a chance that that kit is just not necessarily so accurate. So I do not encourage using those kits. I think they make people very anxious. I think they make the combination of you being anxious and then you being like, TikTok, honey, get home, we have to have sex. And then your husband or boyfriend or partner inevitably gets all stressed out and annoyed that you're asking them to have sex, which is frustrating. So I actually really encourage patients instead, if they have fairly regular cycles defined as anything from 25 to 35 days apart, I tell patients to have sex every other day, day 10 through day 20, which is 6 times we've counted, because then there's a little bit of sperm left every other day. So you don't deplete the sperm count. And then if the egg the sperm is waiting when the egg pops up, then you'll likely get pregnant. But to answer one of the other questions, which is, can stressing out cause any trouble? And suggestions about helping to conceive because it's been 6 months of trying. The statistics show that it takes 1 year for me to get 80% of my healthy patients to be pregnant. So that means if I have 100 healthy patients, in that year, 80 will become pregnant. But that other 20% might need help or might just need more than a year. And that means that those 80 women who got pregnant didn't get pregnant in the first month or second month or even 6th month. It took 12 months for some of them. So the data shows that if you're under 35, you should try for a full year. If you're over 35, you could try for 6 months before kind of seeking help, which we'll double back on in a second. Does stress affect that? So this is what I say all the time. If you have a situation where you can actually moderate your stress, remove your stress, decrease your stress, then please have at it, right? For any of us, that's good. Forgetting pregnancy, stress causes bad things to our body because of the stimulation of cortisol and everything. But if you are in a situation where you actually can't eliminate your stress, then I'm an advocate of believing that no, stress is not going to affect you. And I don't mean that in a silly way. I mean that we have many examples, the Holocaust being the most important one, where they studied women who got pregnant, and those babies in the Holocaust, which I think we can agree is probably the most physically and emotionally stressful event, those babies were neurologically born healthy and intact. So again, does stress affect us? Of course, yes, it does. But should you just relax to get pregnant? I mean, in a perfect world, yes, but I found that to be so offensive and annoying when I was having all my miscarriages and trying, and people would be like, well, don't you think you're just too stressed and you're too, you're not resting and you're just, maybe you don't have to think about it. And when people say that, I wanted to be like, fuck off. That's like all I'm thinking about all day. So again, I can't say stress doesn't affect us. It affects all of us. But I can say I've seen the most stressed people get pregnant. I've seen the most stressed people have healthy pregnancies. And I think adding the stress of worrying about your stress ain't going to help anybody. Okay. So I hope that makes sense. There's like no better way to answer that. As far as helping to conceive after a miscarriage, which was the question, and it's been 6 months of trying, and Lord, that is the hardest because you've had the miscarriage, all you want is to be pregnant again, and now it's taking you 6 months. If you're over 35, I would say go talk to your doctor. If you're under 35, I would say go talk to your doctor if it's been 6 months and you're anxious, but take heart that it might take up to a year. As far as like kind of jumping the gun and seeing fertility specialists, I am a bit of a fan of being more proactive, which is not always the right answer. Depending on where you guys live, where your doctors practice, they might be reticent to send you to a fertility specialist, either because you don't have easy access or because they don't want to make you more stressed, cause you to have to, pay more money. And I fully respect that. But I also think there are a group of women who will feel calmer when they see the subspecialist. So I think you and your doctor have to really have a conversation to try to figure out what category do you fall into? Should you go by the book, wait 6 to 12 months to get pregnant? Or should you kind of jump the gun, knowing that you might not need the fertility specialist's help, but knowing that being in their hands might offer you some sense of calm? And again, this is where medicine is not an exact science. And I don't always go by the book because that's not fair. Some patients will be much less anxious if they're seeing someone from the beginning.
Right.
Right.
And one thing I was just going to add to that, having gone through all the fertility stuff when I was 35 and froze my eggs, just knowing that they are checking all the things is going to eliminate some stress too, right? Because like they're eliminating, it's process of elimination. So then you know that you're being so proactive. And I think that
Right.
brings
Right.
stress down too.
Well, I mean, I agree. And by the way, we should mention Jenny is 45 years old, pregnant with her 35-year-old frozen eggs from a
Yeah.
decade ago. Now, I agree with what you just said, right? I think some of us do feel very calmed by proactivity. But I've also seen in my years of doing this that there are some patients when I say, like, I'm just going to send you just to kind of figure things out, I can feel that their anxiety rises. And then I
Yeah.
have to be very cautious in saying, hold on, let's back up. Is that going to make you more anxious? Because if it is, then you do not need to go. Even if you are not getting pregnant at all, some people just don't want to do that. They don't want to go. They really just want to try on their own. So again, I agree with you, but I think it really depends. And that's the most important thing. I think I want you guys to kind of take home that medicine really, as you guys know, is not black and white, and it shouldn't be black and white. And it really should be a discussion between you and the doctor. And if you're in a position where you can't find someone that you think you can really talk, openly to, then keep looking, because you will. There are great doctors out there. Okay, so the other question, this is an interesting one about a healthy second pregnancy when you get pregnant before your first baby is 1 year old. Sorry, my dogs are up here and they're coughing. So that has to do with, I don't know if you understood the question, but this patient got pregnant when her baby is less than a year old. First of all, I got to say, God bless y'all for having sex that early on, because I did not want to. So let me actually say one nugget about that. Once you've had a baby, it is very common to not want to have sex at all, because nature kind of intended our babies to be spaced about 2 years apart, which meant the inter-pregnancy interval, the IPI, was kind of in nature meant to be, you have a baby, you nurse for that year, your vagina is dry and painful when you have sex, which makes you not want to have sex. Your libido is low because you're not ovulating. And therefore, that was nature's form of birth control, right? Like, stay away. I'm not going to have sex with you. I'm dry and I'm not in the mood, and you're gross and I'm in love with my baby instead, right? Like, that's what happens. So you didn't get pregnant for the year until you stopped nursing. Then you got pregnant. They've done data that in theory, having a short interpregnancy interval might increase the chance of things like preterm labor or growth restriction, because that intrauterine lining hasn't necessarily yet healed itself. I say in theory, I have seen circumstances where patients have gotten pregnant very quickly after a baby, and they have had smaller babies or preterm labor. But the vast majority of my patients who have gotten pregnant with a short IPI have been fine, even after C-sections. So I wouldn't advocate for it. In other words, at the postpartum visit, I remind patients, like, try not to get pregnant for the year. But every year we have dozens of women who we keep joking when they come back are like pregnant quickly. And again, once you're pregnant, then there's no point in worrying about like, oh my God, but what if? Because the truth is the majority of women who get pregnant with a short IPI will still be fine. There's not anything that I can say that has been published with regard to what you should do about it. Like I can't say to you, yes, you should actually rest more or eat differently. I mean, we would say do what all of us should be doing. We should be eating healthily. We should be eating a low processed food diet. We should be drinking half of our body's weight in ounces in water. We should be exercising 30 minutes a day. I don't do any of those things, but that's what we should be. I do think water.
How about
Okay.
medications while trying to conceive?
Right. So, and actually, what this question was about starting thyroid medications in pregnancy. I'm not sure if anyone wants to write in the chat part what they meant specifically, but it's thyroid medicine in pregnancy. So, I'm going to touch upon actually two different pregnancy medications. One is thyroid, one is antidepressants, because I think they're really important to discuss. So, thyroid medication. Many people say, how come we don't routinely check thyroid before getting pregnant as part of the pregnancy workup? And the answer is, in my practice, like if you are with me and you're trying, you should have been seeing your internist as well, because I like everyone to have a regular medical doctor, like a general practitioner, and they will be having their thyroid often checked once a year. Do you hear my dogs running around? The thyroid hormone, if it's low or high, can actually make pregnancy harder. So if you're having trouble getting pregnant, then your doctor will be checking your thyroid. But it is not part of the routine screening because there is actually still controversy as to whether or not subclinical hypothyroidism, meaning hypothyroidism that is not manifested obviously, whether or not that affects pregnancy. If you see a fertility doctor, they'll always check and they will actually treat you with a lower threshold than a regular doctor or a regular endocrinologist. But thyroid medication is very safe. And if there's any question as to whether or not you need it, I would always err on the side of caution because we know how safe it is. It's actually one of the few incredibly safe medications in pregnancy that have been studied pretty prospectively. So I think it's worth it, if that answers the question. The second medication I wanted to talk about is SSRIs, which are antidepressants, basically. There's a lot of different antidepressants, but the majority, Lexapro, Prozac, Zoloft, those are the common ones, are SSRIs, and they really are safe, meaning, like anything, if you don't need medication, don't be on medication. If this is like just taking a little bit of the edge off, don't be on it. But if you need those medications to keep you from getting, from staying in bed all day or from being functional or from really just not letting loose at work or with your partner or with your children, it's important for you to take it. And you should not just stop it all of a sudden. You should not listen to like your friends or your mother or like Dr. Google who says SSRIs are bad because they are not bad. Shh, sorry, you guys. Hey, they have been studied fairly rigorously retrospectively, meaning they've never been studied prospectively where they've taken hundreds of pregnant women and said, please take it and we'll study you, because that doesn't happen. But all the retrospective data is incredibly safe. There are very, very, very small risks to taking antidepressants. So really, like I have a huge number of patients who take it and I would advocate for them taking it if they need it. If they don't need it, of course they should stop, and that's pregnant or not.
Right.
Okay, so
well, should we, that's all, thank you. That's so, so helpful. Should we shift over to first trimester questions?
So so there's a bunch of questions about pain and about what's going to happen in the first trimester when you go to the doctor. So I just wanted to give a little overview. Like this is my quick timeline of what happens. So this is going to encompass a bunch of these questions. So you've peed on the stick, and as we joke, you've peed on like 5 sticks, because if you know anything about getting pregnant, you think you're pregnant, you pee on the stick, you don't believe it, you pee 5 more times, and then I joke like you keep it in a Ziploc, and then you find it 5 years later like under your sink, and you don't know if you should throw out those old pregnancy tests or not. That happens to almost everybody. Give me a shout out if you believe that that is true. Someone's asking, are we going to share the recording? Jenny, can we share the recording?
Yes, I just wrote that we can absolutely do that in a follow-up email.
Our technical person says, yes, we're going to do that. So you find out you're pregnant. You should call your doctor's office, not at 3 a.m. The next day, call your doctor. Hey, I'm pregnant. And your doctor's office, the secretary will likely say something like, what's your last period? And then they have you come in typically at about 8 weeks for your new OB or your first OB appointment. That can vary based on a couple things. Certainly if you're having pain or bleeding. And when I say pain, I don't mean cramps like a period, because that was also a question about having cramps in the first trimester, or tingly pain. It's very common to have cramping, first of all, as the embryo is implanting, but then even after that, you'll cramp like a period. Your uterus is teeny and it's growing. as that embryo is growing. So you're going to have some cramps. So if it's cramps like a period in the middle, I'm not worried. If it's pain on one side or the other, or you're spotting your bleeding, you should call your doctor's office because they should see you to make sure that it is not an ectopic, which is a pregnancy growing outside of the uterus or in the tube, because that is not incredibly common, thankfully, but not so rare and something that absolutely needs to be addressed because it's concerning. Okay. So let's assume that doesn't happen. You call the doctor, they have you come in again around 8 weeks. It might be 7, it might be 8.5, but in that range. The idea being that that's when we'll definitely see the heartbeat and we will have avoided some of those very early pregnancy losses that can be emotionally harder to deal with if you've already come in and seen the doctor with the heartbeat. So again, by and large, the rule is 8 weeks. Many doctors kind of break that rule. Like, you're nervous, you're anxious, just come on in. You had a miscarriage already, you feel better coming, just come on in. But I don't want any of you to be anxious or worried. If your doctor said come on in, it's not because she thinks there's a problem. It's because she's probably just trying to be nice. Like, if someone said here, a 35-year-old patient, she had a 6-week ultrasound to confirm the heartbeat because she had had a miscarriage. And the doctor said that was her first official appointment. She would have another first official appointment 2 to 4 weeks later. So that doctor, I think, was just being nice, meaning you didn't need to go in. I think she just honored and thought you were anxious, you were nervous, you had had a miscarriage. Come on in, we'll show you the heartbeat and we'll show you everything's okay. Then you'll come back and we'll do all the details, like the questions and things like that. And I don't think there's anything wrong with that. And to that point, being over 35, so we'll talk about the rest of the timeline. You go in for your regular doctor's visit, they look, they do the measurement, they see that little heartbeat. That's fairly standard throughout the country, I'd say, meaning most doctors nowadays have access to an ultrasound or at least send you to an ultrasound department. So it's rare to kind of get through the entire first trimester with no ultrasound. I don't know if I'm wrong. If anyone else on this panel has not had an ultrasound, let me know. But as of the last couple of years, that's pretty standard of care. So you have your first ultrasound, your doctor talks to you about all the tests, some of which have to do with just routine blood tests like HIV and hepatitis and blood count and blood types, some of which have to do with the tests for things like Down syndrome, which is called the cell-free DNA test. And then they'll talk to you about the 12-week fancy ultrasound where they measure the neck. And then you're on from there. You've got several more tests throughout. Being over 35 for us doesn't change very much, meaning most doctors nowadays, and the American College of OBGYN, ACOG, really has come out saying we should offer all the tests for Down syndrome to all patients, regardless of age. And like I always say, you could be 18 and the answer of Down syndrome matters to you versus being 49 and the answer of Down syndrome does not matter to you. So I offer it to everybody. Most doctors should. That's what the guidelines say. Doesn't mean insurance always covers it. Those bastards, they sometimes don't cover it under 35. But the guidelines are very clear that we should offer it to everyone because the testing now is not invasive. It's not an amniocentesis. It's just a blood test. Okay. As far as other issues with being over 35, we know that the chance of getting pregnant is a little bit less. But if you're already pregnant, we're done with that. The chance of Down syndrome goes up every year a little bit. But the whole fear, I hate the word fear, right? But the fear of being 35 is very misunderstood and misguided and old-fashioned in a way, because it was based on the fact that in the past, the only test we had for Down syndrome was when we did an amniocentesis, when a needle went through the patient's abdomen to test the fluid. Otherwise, we didn't have a test, and the risk of a miscarriage from that needle test was greater when you were under 35. So that was the 35-year-old cutoff. So really, it's not as though all of a sudden at 35, your risks of everything go up. As women get older, our risk of diabetes and high blood pressure goes up. But otherwise, again, it's not as though 35 is this terrible time. I don't like to use the word like geriatric pregnancy or, advanced maternal age. They sound terrible and they don't add anything really. I say each patient has certain things during their pregnancy that we need to pay attention to. I don't like the term high risk pregnancy either, because again, every patient, a 22-year-old might have issues we have to pay attention to, a 49-year-old might have issues, and vice versa, they might not, regardless of age. Okay, so questions about that, Miss Jenny?
No, I think you covered it. We just had one person mention that at their office, they do not do an ultrasound until the 20-week anatomy scan, unless you have, when your last period was, unless you've had previous pregnancy problems. But that's pretty common, right?
Yeah, so that is Julia. That's Julia in Kalamazoo. Hi, Julia in Kalamazoo. So they don't do an ultrasound. Interesting. I can't say they're wrong. Listen, it's wrong for me to say they're wrong because they might have different access to technology. There is a pretty clear statement with American College of OBGYN that it's good to do a dating ultrasound in that first trimester because that's the most accurate time to date the
Right.
pregnancy. Because if we only go based on last period, we'll be wrong a good 25% of the time, and trying to do the measurements at the 20-week ultrasound when the baby is bigger is not as accurate.
Right.
Meaning, if you guys picture it, anyone who's pregnant right now, if you're going to have a 9-pound baby or a 6-pound baby, first trimester, your babies were all measuring the same. By 20 weeks, some babies are measuring a little bit bigger or a little bit smaller. So I'm a little bit surprised they're doing it, but it's not wrong again. Okay, so another question was about pregnancy symptoms and when do they improve and what happens if they stop? So let's review like very common normal first trimester symptoms. You're pregnant, you're so excited, you're thinking like, I feel great. Oh my God, that's terrible. I don't want to feel great. And then all of a sudden you feel like crap and you're like, ugh, I don't want to feel like crap anymore. And then all of a sudden you feel good and then you're worried that you feel good. So that whole gamut happens. But you might have anything from no symptoms to mild nausea to vomiting every day in the toilet, breast tenderness, cramps like a period, feeling like you have to pee frequently, not because the baby's big, but because your ureters and kidneys are filtering differently. So all those symptoms can happen the minute you find out you're pregnant or all the way up through the first trimester. I'm not worried when any of those symptoms starts to get better, especially at like 10-ish weeks, because by 10 to 12 weeks, that's when they're supposed to start getting better. If someone says, God, I've been so nauseated and I'm 7 to 8 weeks pregnant, all of a sudden I woke up and every symptom went away, I can't say I'm worried, but I do get a little bit concerned because sometimes that's a sign that the hormones have started to drop. And when those patients, because they Google it, they do get worried and then they come in and see us. And good news is many of them are fine. And unfortunately, occasionally, some of them, that lack of symptoms suddenly again, about 7 or 8 weeks, not at 10 to 12 weeks, could have been a sign that they were having a miscarriage.
And I'm just going to jump in real quickly because I got a direct message from somebody. Is it normal to have no symptoms? And
Yes.
I know you mentioned it, but I just want to reiterate that
Yeah.
is in fact, because I actually personally did not have a lot. I got nauseated a little on the later side. So
Yeah.
I was sort of expecting it to happen and nothing really happened. I didn't have a lot of symptoms in the beginning.
Yeah, no, I mean, really, really, the gamut is wide. Some
Mhm.
patients are like, I have no idea I'm pregnant. I've had patients walk in. Again, these are educated women who are thin, who are not like dingbats who didn't know they were pregnant. It wasn't like those weird, those stories like, oh my God, I birthed at the prom. I mean, these are educated women. They didn't know they were pregnant. And they were like, they never got their period anyway because of hormonal issues. And all of a sudden they're 16 weeks pregnant with no symptoms. So you really can have no symptoms. Do not be worried about that. Or you can have terrible symptoms. And they're terrible. Pregnancy, I don't know. I'm the kind of person who doesn't think pregnancy was that much fun, but it's a beautiful thing. Okay. Exercise during pregnancy in order to help with a healthy weight. So let's talk about exercise in general. And actually, everyone get a pen. I want you guys to Google, Jenny, maybe we can find it and add it here.
Okay.
There is the ACOG. I'll keep repeating ACOG. ACOG is the American College of OBGYN. If you just Google ACOG do's and don'ts of pregnancy, there's a great, 10-page paper that really delineates what our governing body is really telling us about what foods, about caffeine, about exercise, about all of those things that are like, but I Googled it and it said that I can't have caffeine. That's wrong. Google should say 200 to 300 milligrams of caffeine. Exercise, you can do any exercise that you are already fairly used to, because the issue with exercise is twofold. We used to think that you don't want to get your heart rate too fast because if that was too fast, then maybe the blood supply to the baby wasn't that good. But that was actually never studied. So while people will still say keep your heart rate below 160 to 170, it's actually based on no data. So really, we should not say it. And ACOG do's and don'ts talks about that. The second issue is your own ligaments. So you, during pregnancy, you have a lot of hormones surging through your body, and some of those hormones will actually relax the ligaments in your arms, your shoulders, your legs, your hips, and everything. So if you're doing rigorous exercise that you're not used to, or you're overdoing it, for example, with weights or CrossFit, you can cause harm to your own body, but you're not going to harm the baby. The baby is very well insulated. Like I say to my patients a lot, if this pregnancy is meant to be, then the likelihood is it is going to be no matter what we do. We would have a hard time trying to harm it. On the sad side, that means, unfortunately, there's not a ton we can do to try to kind of help pregnancies that aren't meant to be. So it's kind of a good news, bad news. Luckily, often more good news, because we're very worried that we're going to harm our pregnancies. And I am telling you that it's very hard for you to harm your pregnancy, despite what Dr. Google makes you think. That doctor, I hate.
And can I just add one quick thing about exercise? I have found, because I was a pretty big exerciser before I got pregnant. And I have found there are so many great programs. They don't cost very much, but they're prenatal exercise programs. And they have all sorts of videos that are geared totally to being pregnant in the different trimesters. And so I love them because I feel very safe doing them. Like, if you were an avid exerciser, you can still do a burpee, but they have you doing it at sort of more of an incline, for example. So you're not totally down on the ground and potentially causing a little bit more stress to the abdomen. So I highly recommend finding one of those programs.
I love that you say that ish. It's the only
Okay.
reason I think the value is very much your psyche, right? And anyone who knows me knows I value your psyche almost more than your physicality, because your psyche will affect that. What I mean to say by that is, even some of the best yoga instructors, I mean, I say that I've seen, but I don't do yoga, but best yoga instructors that I know and I hear about will say things like, don't lay on your back, or you shouldn't do this on your stomach, or you can't do crunches. And that is, again, not physiologically, medically true. It is not something anyone has studied, and it doesn't even really make sense, because the uterus is well insulated. If you're doing a crunch or a burpee or whatever you're doing that's affecting your abdominal wall muscles, you might affect your abdominal wall or your ligaments, but it's not going to hurt the baby inside the uterus. Now, again, if your psyche has you anxious that it is, then by all means do these programs, because they also foster community, which I love.
Right.
But I don't want people to think, if I don't do a specific pregnancy program, I'm going to harm the baby. You are not going to harm the baby. It would be incredibly hard. And data finally came out supporting what most of us as doctors knew, which is laying on your back as long as you are comfortable. So this has to do with exercise and just second, third trimester symptoms. If you lay flat on your back and you get short of breath or your legs go numb, then that is a sign that you shouldn't lay flat on your back. I think I don't even need to tell people that, because it makes sense. If something's going to make it hard for me to breathe, I'm not going to do it anymore. But if you lay flat on your back and you have no trouble breathing and your legs do not go numb, that's distal to your uterus, right? Farther away from your uterus, which means that proximal, which is right underneath your uterus, is the blood vessels that are getting compressed they worry about. If they're not getting so compressed that the distal parts are still getting blood supply, then you're fine. Your uterus is okay and your baby's okay. And again, study finally came out supporting that, but the books and Dr. Google have not caught up with that. So
Right.
I love and honor that you're doing those classes, because again, you should be doing exercise. I should be doing exercise. But I really implore all of the panelists here to feel okay doing whatever exercise they were already used to doing, mindful of their own joints and bodies, right?
Right. Right.
Because that's really something that's very important for people to kind of think about.
Right.
Are there any exercises you shouldn't do when you're trying to conceive or newly pregnant? Again, the answer is no. Even like hot yoga, I mean, we would say, okay, don't do, I don't really know what temperature hot yoga is, like, don't do like 120 degrees, because that's so hot that your core temperature can go up, right?
Mm-hmm.
Which actually
Mm-hmm.
makes me think of baths. People always ask about baths. Your core temperature, we do not want to go up, because if you have a fever, which means your core temperature is going up, or if you're in a hot tub, for example, or doing the really hot yoga where your internal core temperature goes up, then we worry that it can increase the risk in the early part of pregnancy for spina bifida, which is neural tube defects, okay, which is rare, and that's only in the early part of pregnancy. So you really can do any exercise. Like, the general vibe, what we say is an exercise that you've already done, so that your body's already used to it.
Mm-hmm.
So you're not asking your body to get used to, from a ligament perspective, again, something that it hasn't done before. Okay, another patient had said she's 8 weeks pregnant on progesterone, and she is supposed to stop at 12 weeks and she's nervous. So just to give you guys a little background, if you're trying to conceive, your doctor might check your progesterone level, especially if you're with a fertility doctor. And sometimes they'll supplement progesterone in the early part of the pregnancy if it's in the low normal range. Or sometimes I'll have patients where they've had a miscarriage, they're just anxious. And again, for their psyche, they want to do something. Taking progesterone is incredibly safe. It's what you need in your pregnancy anyway. It's typically given to your body and to your pregnancy by the corpus luteum, which is the cyst you get in your ovary, until you reach about 12 weeks, when the placenta takes over. So that's why you will get supplemented, if you need it, by your fertility doctor or your regular doctor, You'll get supplemented at the beginning and then you stop around 12 weeks. It's so normal to be anxious. I took it in a couple of my pregnancies for no reason but the fact that I had a miscarriage and I was just wanted to do something. It was like voodoo, I said, because it's low risk. The likelihood of needing it is really small, but it just made me feel like I was doing something. And that day you finish, you get anxious because I think as humans, we all like to know what's going on. Like, are we doing something different? And if we're doing something different, then we feel better. But the only thing I have to say to whoever asked that particular question is don't be worried. Your placenta is going to take over and you probably didn't even need the progesterone at all. Okay. Someone else. Oh, someone was just asking something. The same applies to sleeping. Yes, Jenny, you said about sleeping and on your back. Okay. Those were all of the kind of earlier questions. Oh, we had questions about weight gain also. So weight gain during pregnancy, generally we say if you are in a normal weight range, then you should gain about 25 to 35 pounds. If you are underweight, you could gain a little bit more. And if you're overweight, you should gain a little bit less. The truth is, it's hard. When you're pregnant, you're definitely either like eating for two or you're so nauseated that all you want is to eat like carby, salty food. It's like being hungover. You want to like fill your stomach with crap. And so I tend to, unfortunately or fortunately, be not very dogmatic about it, but that just is in support of the fact that my brain is terrible with food because I'm a food addict. So I don't want to preach to my patients. I want to be responsible. And if I think there's a patient who would benefit from us discussing it, I would. But in general, I think trying to not gain too much weight is always prudent, and trying to not eat too much of the processed food and sodium, because we know that that can cause water retention. Too much weight gain can absolutely, unfortunately, cause gestational diabetes and increase your risk of preeclampsia and hypertension during the pregnancy. So don't do it. But I did it. I gained 50 pounds in my first pregnancy. It was terrible. I know. Okay. Any other questions that you can think of, Miss Jenny, or guys, anything else that you can think of on the side?
Only other thing, I was just going to quickly, it's really kind of coming up in the next section anyway, but it's sort of going back to sleeping. And we answer the question, about waking up on your back and being nervous. I wake up on my back all the time and I'm just, it's comfortable. So, and sleeping is important. So I think if you find a good position to sleep in, that's good. But also somebody just asked about, in second trimester, can I safely take something at night to help?
Yes. That's Miss Cami. Cami is one of like my Instagram people that I get to see a lot. We don't know each other, but we know each other on Instagram. So, okay, sleep is such an important thing. You guys, sleep is like one of my favorite subjects to talk about because it's so important and I love to sleep and I don't get enough sleep, but I love it. So sleep is important. It is when your body regenerates and heals. So in general, non-pregnant, you need to sleep. Pregnant, ideally you need to sleep. What happens during pregnancy? You can't fucking sleep. It's just like menopause. So as I joke, when I say to when patients like, I'm having a little trouble sleeping, and I say like, let me guess, you're waking up at 2 or 3 in the morning to pee, and then you can't go back to sleep. And sometimes they're like, are you watching me? How did you know that? And I know that because that's what happens to all pregnant women and in menopause, by the way. So 2 things you can do to help you sleep that are so impactful and important and easy and safe. Magnesium. So I've talked about this on Instagram a lot with my patients, but magnesium is magic. It helps you sleep, poop. It helps with anxiety, leg cramps, and headaches. I feel like everyone can or should take magnesium, pregnant or not. And I say to keep it easy, I hate to tout any pharmacy, but it's just the one I go to is CVS. They have CVS brand. It just says magnesium. So I'll like write it on a note with my patients and I'll say magnesium in quotes because there's like magnesium citrate and threonate and all glycinate, all different kinds. This one is just plain magnesium. I think it's a combo of a couple. It's 500 milligrams, 1 pill at night. Every night before you go to sleep, it really helps you sleep. So that's one thing you can do. And on top of it, if you need it, what the antihistamine that helps with nausea and sleep is the brand name of Unisom, but the tablet form of it is the one you want because the gel cap form is actually not the one you want. So Unisom, which is also called doxylamine. Jenny, I don't know if you want to type those in, but 500 milligrams of magnesium and doxylamine. You can take the Unisom doxylamine sleeping pill literally every night in your pregnancy and it will be safe. It is a category A, prospectively studied in pregnancy. It is so good. Okay. Someone is asking, she had a neurologist she was seeing for headaches and was taking magnesium, was asked to stop when she got pregnant. I have zero idea why. Maybe the formulation they gave you, they thought would be more of a stimulant, because there are a couple forms, one in particular, I think 3-8 maybe, that can stimulate rather than calm down. But I have no idea why. It is absolutely safe. 100%, like
I take it
100%.
every night, every night.
Take it every night. But by the way, ask your doctor. I'm not your doctor, so ask your doctor. But if the doctor says no, I wouldn't listen. I hate saying that. Okay. So let's move. Yeah.
Yeah, go ahead. Go down the questions. I'm answering some people's questions in the chat while you're going. So
Okay.
you carry on.
And it's already 8:07. We got
I know we got a cruise.
Okay. Next couple questions were about pain during like that second or third trimester, restless legs, sciatica, and about using the Doppler. So let's go through pain. I'm usually doing the standing up, but I'm not going to stand up right now. But I say to my patients, like before they get into that like late first trimester, late second trimester, early third trimester, your uterus that looks like an upside down pear has ligaments that come off the top of it and insert into your groin. So imagine that anywhere across the top of your uterus, all the way down the sides and inserting into your groin are the round ligaments. And those are going to cause pulling and tugging and stretching. It will literally sometimes feel like something has exploded. Like I've joked, people have heard me say this, that I sneezed once in my first pregnancy and came out of the bathroom and said to one of my partners in my practice, I know my ovary exploded, but I'm okay. And it really feels like a snapping, terrible feeling sometimes. And that's your round ligament. So those round ligaments that come off the top, insert into your groin, can be pulling, tugging, a kind of explosive, crampy, like stretching feeling. When you flip over in bed or when you get up, you might notice it more. Also, you have a ligament that attaches to your sacrum, so your lower back will start to pull and tug. Your pubic bone, which comes together in the midline and has cartilage, that'll start to separate. So when you get out of bed, imagine your pubic bone will kind of separate and come back together and separate and come back together as you're flipping over in bed or getting up, and that will really hurt. It'll feel like someone kicked you in the vagina with a boot. We don't know why, but that's just the pressure probably from the baby's head. So these are all, unfortunately, incredibly just terribly uncomfortable, but very common, completely normal. And as long as you're not feeling persistent pain in your abdomen that doesn't get better with movement, like meaning if you change positions, that pain should improve. That's usually something like a ligament. So if it's persistent pain or you're bleeding or you're not feeling the baby move, then I would be concerned about those things and I would tell your doctor. If it's just pulling and tugging, aching, but you switch positions and it gets better, that's a sign it's typically just everything growing and pulling and stretching. The other thing is sciatic nerve. So for those of you who don't know, the sciatic nerve goes like kind of through your buttocks into your hip almost a little bit and down the back of your leg. So you'll feel either a pain literally in your buttocks, like in your gluteus, or in that hip. It'll feel like an electrical shocky pain that goes all the way down the back of your leg. And again, terribly uncomfortable. You can do certain exercises. I know this person particularly tried a chiropractor. If that didn't help, you can always switch. I know it sounds funny, but sometimes you need a chiropractor or an acupuncturist or a pelvic floor physical therapist because they all do things a little bit differently. Or you actually just need to wait. Sometimes just waiting it out a week or two, it magically just gets better. It's actually because the nerve, the sciatic nerve, is very kind of exposed. It wasn't insulated well. And so when you're pregnant, the general swelling, the edema, we call it, can kind of impinge on that nerve a little bit. Again, totally frustrating, but common. Someone else had asked about a painful pulling sensation under her belly button that goes away when she's lying down. And that's, again, her round ligaments, because she said right at 20 weeks. I'm going to teach you guys something fun about your uterus. Your uterus, until you get to 20 weeks, you really can't feel it much. That's why you don't see much of a bump. When you get to 20 weeks, your uterus, the top of your uterus, the fundus we call it, will be right at your belly button. And then every week after that, it'll grow a centimeter. I always say it was so smart. God made it so smart. 1 centimeter per week. So if you want to know how big your uterus feels, you lay down flat on your back, and you might not even realize this, that whenever you see your doctor, they put their hand on on your belly. They might use the tape measure, they might not, but they're touching the top of the fundus to see, does it look above the uterus the appropriate number of centimeters that it should, given how many weeks you are. So for example, if you're 26 weeks pregnant, the top of your uterus should be about 6 centimeters above your belly button. Plus or minus 2 centimeters is the spread we give because everyone's anatomy is a little bit different and everyone's baby is a slightly different size. Okay, another question about restless legs. Restless legs can be for a couple of different reasons, but the two easy things to think about, it could be because of anemia. If you're truly restless, then you might be anemic, which is common in pregnancy. Your iron levels go down because you just get diluted and you're not making enough iron. So that's something your doctor will check at 26 to 28 weeks, but if it's really bothering you, they could check it earlier. So, and then giving you iron would help. The second thing is it could be, I don't know if this person meant restless leg or leg cramps, those horrible Charlie horses. The magnesium again is magic.
Yes.
Okay. Okay. Fetal Doppler. And then we're going to move on to COVID and then we're going to be done soon. So Doppler, this person said she's been thinking about purchasing the kit, but she's read the Doppler can give a false sense of security. And actually it can. I have to tell you that, and Jenny and I are going to talk about the kit in a second. And those of you who don't know what we're talking about, we have our My OB and Me pregnancy program that we actually were calling our pregnancy kit. But we really started out wanting to create education for pregnancy and for gynecology. And then because of COVID, we realized people wanted telehealth visits. So that was an easy way to kind of put a fire underneath our butt and get us to move ahead with this kit. What we've really found through a lot of market analysis in the last couple of weeks is that what people really have liked is this kind of form of community. Talking to each other and talking to us and hearing us talk about pregnancy has helped a lot. I think it's really valuable for people during COVID to have the opportunity to do a telehealth visit with their doctor. And I think it's actually really valuable outside of pregnancy to do a telehealth visit for some of the low risk visits where you would do your blood pressure, listen to the baby and dip your urine on your own. But again, in a telehealth situation, I would not use a Doppler just like, God, I really want to hear the baby, or, I'm not sure I'm feeling the baby move. I really, really discourage you from using our kit for that at all. It is not our intention. And I don't just say that to cover our ass. I really don't want people to. A patient was in my office, in fact, yesterday, who, just happened to have a Doppler unrelated. And she said, oh, I listened and it sounds great. It was 80. The rate was 80. Now, she did not know. She hadn't even Googled what the heart rate should be. And I listened with her and I said, listen, this is the baby's heartbeat. It's 120s, 130s, 140s. It should be anywhere from 110s to 170s. It's not 80s. That was her pulse. So I would be really cautious. In other words, the best reason to be part of us in our community and buy our kit is if you want to be part of us in our community. If you just wanted the Doppler, you can buy it like on Amazon. But I wouldn't even advocate for you buying it on Amazon unless you're using it in the form of a telehealth visit, because really otherwise it can just make you more anxious because you're going to listen every day and then you might not hear the right thing. Okay, we're going to talk 5 to 10 more minutes about COVID. Okay. But let me just answer this one really quick about mucus plug. Someone said, does losing your mucus plug mean you're going to be in labor? No, I joke. Don't call your doctor with your mucus plug, please. Like, this is something we talk about in the ebook, and it's a big joke in the doctor's world that like people literally will send us pictures of like the glob of mucus that comes out. For those of you who don't know, your cervix holds a glob of mucus. It's meant to be a barrier for bacteria to not get up inside your uterus. And sometimes towards the end of pregnancy, it'll either blop out in the toilet, it'll look like a big snot, or it will slowly dissipate at the end of the pregnancy. And that's when you'll notice a lot more of that drippy, yucky, white, clearish discharge. It is not like plug is out, baby's coming in 24 hours. If it were, life would be so much easier, but it's not. Right. So it doesn't mean anything. You don't need to tell your doctor. If you think you lose your mucus plug earlier than 34 weeks, I guess I'm going to say talk to your doctor because that's early, but that's so rare. Okay, COVID, you guys. Just feel like I never want to say I'm sorry because I don't want to say sorry to people and make them feel sad about whatever they're going through, but I am sorry that anyone who is trying to conceive or pregnant right now during COVID has to go through it. It is hard. It's hard enough being pregnant. It's hard enough going through COVID, and together I know they're hard. Though some patients have benefited, and I'm thrilled that they get to stay home during their pregnancy because of COVID and work from home. So that's a good benefit. Let's talk about my view, and anyone who's watched me knows I'm a huge fan of being proactive, not paranoid. I'm a huge fan of approaching it like this. I'm going to try not to get COVID. I am going to wash my hands. I'm going to physically distance, and I'm going to wear a mask. And I'm going to boost my immune system by sleeping, by taking a prenatal or multi, which we didn't even address here. That's a whole nother topic, but we talk about it in our book. Someone had asked about taking should they take extra vitamins? Again, I'm not your doctor, but if I am your doctor, this is what I would tell you, and you guys can ask your doctor. Always prudent to take extra vitamin D3. We all need it. So there's no harm in you taking an extra 2,000 IUs of D3 on top of whatever is in your multi. There's no harm in you taking 500 to 1,000 of vitamin C to boost your immune system. Selenium and zinc, I can't say I would necessarily tell you to take extra in pregnancy because I just don't know the data about it. And I don't know that it's worth it or valuable. So I wouldn't encourage those. I wouldn't discourage them, but I would encourage them. I would encourage D3 and C if you want to take something extra. And I would strongly encourage sleep. Sleep is one of the best things you can do for your immune system and your psyche and your overall body's healing. Okay. Using a mask is incredibly important. It has been shown to help. Those of us in the medical community know that because we're constantly exposed and we do not get, as knock on wood, we have not gotten COVID the way we did prior to wearing masks. So the American College of OBGYN, Society for Maternal Fetal Care, for Maternal Fetal Medicine, and ASRM, which is the Society for Reproductive Medicine, have all come out with clear statements about the COVID vaccine that if you are in a high-risk category, a healthcare worker or someone who is very immune compromised, pregnancy alone is considered an immune compromise, by the way. You should be allowed to get the vaccine if you want it. And for those of you who logged in a little bit later, you might not have heard me say it, but I really liked the way they said the statement because they were very clear that you should be allowed to get it, but you should not be forced to get it. And that it really should be a shared conversation with you and your doctor, which I think is great. It is not dogmatic the way they said it. They left the door open that pregnancy and breastfeeding, it is considered safe to the degree that they know scientifically. There weren't studies in pregnant women or lactating women, but it's an mRNA virus. I mean, an mRNA vaccine, which is not actually any live virus. It just attaches to the outside that allows your body to create the material to kind of mimic that protein to create antibodies. So it's really considered as safe as they know. Now, do they know all the data? Of course not, because they have not studied it prospectively. But to the degree that the science can tell them, it is safe. You could get it if you feel like you're in the right risk category, but you should not be made to feel like you have to do it. And that's really important. We should not shame people into doing it, nor should people malign the medical industry for trying to encourage it in the right population. So again, it should be a very healthy back and forth between you and your doctor, if you even have the opportunity to get it, if you're in the healthcare field or not, right? As far as what happens in the hospital, every hospital is a little bit different, but most hospitals, when you walk into the hospital in labor, you will get tested for COVID. Your partner, most hospitals won't test the partner because they just don't have the infrastructure to do that. The partner will be masked. You don't have to be masked if you're COVID negative, though I tend to encourage the patients to like try to wear it when they can, just because they still could get exposed to staff members. We're not all tested regularly as doctors and nurses, though we're all wearing masks. So it's unlikely you're going to get it at the hospital. But to the degree that you can wear the mask when you're not huffing and puffing and pushing, try to wear it. And there's other times when you're going to be pushing, you're going to take it off, and that's okay. And our hospital, and in many hospitals, if you are asymptomatic COVID positive, your partner can still stay with you, which is different than in the past. But if you are symptomatic, they usually don't allow the partners to stay, and they do not isolate you from the baby. In the very beginning, they would take the babies away and isolate, but that is discouraged now. You stay with the baby, you stay masked, you can nurse. You're actually encouraged to nurse because the antibodies will help protect the baby as well. And thus far, the majority of the babies who have been born were COVID negative, and those few that were COVID positive were fine. And you guys have heard me say this too, that even though the data has shown that pregnant women are more likely to get sicker and more likely to get intubated, and God forbid even pass from it, the numbers are still incredibly small. So the chance of getting it, getting sick, and dying from it is still incredibly, incredibly small. So just be cautious. I would not advocate for like not wearing a mask or being in crowded places, but I'd also never advocate for being too scared or stressed out, right?
Right. Right.
Yeah. Okay. Any other questions? So, last minute. Someone asked about recommended sleep during pregnancy. There's no more recommendation of sleep during pregnancy than non-pregnant, but in general, we should all be getting 7 to 9 hours. More than 9 hours seems to be too much, and less than 7 is not great. But I say that it's hard because a lot of us don't get that much sleep. And then someone else, just really quick, Julia from Kalamazoo. I love that she's from Kalamazoo. Braxton Hicks daily, is that normal? Braxton Hicks contractions, just so you guys know, are when you have tight, your uterus feels like it's getting tight and hard, or you're getting cramps like a period. It's very common, especially in your second pregnancy. It's common to have it earlier and more intensely. In your first pregnancy, it's not so common to have them at 21 weeks that frequently, but it depends on what you mean. In other words, I would tell patients like 10 to 15 times a day, you're having just an erratic, it's tight and it's hard and it goes away. And it's not in a pattern like every 5 minutes, and you're not bleeding, you're not spotting, you're not having a ton more watery discharge than usual, then it's likely nothing. But the other thing is that you should always talk to your doctor, because sometimes what you perceive as Braxton Hicks could actually be a bladder infection, a urinary tract infection. It can cause some of those same symptoms.
Right.
Okay. Oh, and then B6 and Unisom for nausea. Yes, totally safe. Unisom is that tablet that I talked about, doxylamine for nausea and for sleep. And B6, when you add to it, it's safe. And actually, that's actually a good segue because we need to end soon, but we do want to tell you guys about the program we're talking about because it's exciting. Jenny's going to go through a quick little slide about it, but a lot of these questions about B6, Jenny, if you want to get up that slide, then I'll just look through these to answer while we were talking about it because in fact, almost everything here, I see someone talked about cramping in the second trimester. Should she be concerned? Again, cramps like a period, very much essentially Braxton Hicks, but it could be a UTI. But it's really common to have cramping as everything grows. The question about B6 and Unisom for nausea, that we answer that in our ebook. So yeah, those are totally safe. That's actually the first line of things you should try if you are nauseated during pregnancy. How much vitamin D do I recommend? I am not everyone's doctor. I'm going to keep covering my ass and saying that, but I recommend, they have done data that 4,000 IUs of vitamin D in pregnancy can decrease preeclampsia and preterm labor. So I tend to not say take 4,000 to everyone. I tend to say like 2,000 to 3,000. And there's only about 1,000 at most in your prenatal. So I would say at least 2,000 to 3,000. Jenny, are you ready with that?
Yeah, I am ready. So
Great.
why don't we do this? Of course, the questions keep pouring in and we have to, well, maybe at the
So
end.
guys, listen, all joking aside, for any questions that we didn't get to, if you are following either of us or all three of us, Jenny's Instagram, mine is Big Love Fierce Juju or Tribe Called V, please, please, please go ahead and send me these DMs that I didn't get to. Although it looks like we're getting to
We've gotten to a lot of them, but yeah, why don't
yeah.
I'm going to just do a quick.
But I do want you guys to hear about this because I actually think like this is a perfect example. Like I love that you guys have all these questions. These are questions I see in my office all the time. But even my patients in the office, like anyone who's on here who is my patient, you guys know I talk a lot, but I don't even get to answer everything, right? Because there's just only so much time. And so our purpose in starting any of these programs is specifically this, that we want to make sure that you guys get all this information so that you can have a better relationship with your doctor. Like this is not meant to supplant your doctor. As we joke, I don't want to be your doctor. I can't be your doctor. I don't have time to be the doctor. I don't take new patients. I want you to love being with your doctor, and I want your doctor to have the ability to answer fewer questions with you in a way that you could have found out through like our program or somewhere else so that they can actually really bond with you. Because I think that just makes your relationship with them better, your experience better. And because I really love doctors, I want to make their experience better too. Right?
Right. All right. Well, first of all, Shieva, amazing. She's a speed talker getting through all those questions and so good at it.
Fast.
So good at it. But we want to tell you guys all about we're only going to take 2 minutes of your time. We want to tell you about our My OB and Me pregnancy program, as Shieva just mentioned. And basically what you get in this program is this 200-page pregnancy ebook that she and I both wrote. We're going to go into that in just a second in a little more detail. Access to our private Facebook group for a whole year for community support. 2 to 4
by the way,
times.
is like this. Like the Facebook group is twice a month at least with us, and then a couple more with like all kinds of other people.
Yeah.
Physical therapy, pediatricians, lactation, everybody.
Yeah, 2 to 4 times with, Shieva, myself, other guest speakers. We're going to do all sorts of interesting subjects. And for the next 75 people who join our program, you're also going to get the components of the kit because as Shieva had mentioned, we were originally focused more heavily on the kit, but then we realized that the community and the education is really where people are even more focused. But having said that, the medical components, as we discussed, we've got the blood pressure cuff right here. We have the fetal heart rate Doppler, the urine dipsticks, and the drawstring carrying bag. So these are all the components that are really going to help you have a super engaged visit, telehealth virtual visit with your doctor, to use these things at home, which, going into the winter with everything that's going on, a lot of women don't want to go into the doctor's office for every single visit. This is, of course, for low risk pregnancies and just for a handful of your visits. And that would be the purpose of some of these medical components. But some of the things about the program that we want to emphasize even more is, for example, this ebook that the two of us wrote. It's 220 plus pages written by both of us. We go over all things pregnancy and lifestyle. So it's not just medical stuff. We go through, I'm an integrative nutrition health coach. So we go through all sorts of lifestyle things, nutrition, exercise, stress management, sleep, all the various things that we've touched on very briefly today, but of course, don't have enough time to go into great detail. You can find so much great information in the ebook. Our mission was to truly address a lot of what may occur in your pregnancy journey. So that, as we've mentioned multiple times, you avoid doctor Googling, because that creates so much anxiety. And so it's this ebook really encapsulates so many of the things that a lot of pregnancies may experience. And so we want to preemptively get ahead of it. So should the doctor say, you know, you've got X, Y, and Z going on, you will already have the information to know that you don't need to get super anxious. And then just to go into the details of the program itself, it costs $295. And so we just like to encourage people to think about this as an investment of $25 a month for a whole year of support during your pregnancy journey. Support from other women going through the same stuff. I know with COVID, we're lacking connection and talking to other people, and this is an opportunity to be able to do that. Access to Shieva, myself, to discuss all things pregnancy, health, and nutrition. The ebook, as we mentioned, giving you tons of education, and then the medical components enabling you to do some telehealth monitoring from your home this winter with your doctor. And so if this sounds interesting to you, which we hope it does, we'd love for you to join our tribe and join this program. Just go to tribecalledv.com and then click the option for the My OB and Me pregnancy program. And for those of you watching today, we are offering a special code to get $45 off the program and free shipping, which is a total savings of $60. But you have to use this code December Zoom, but it's actually DECZOOM. If you put that code in, you're going to get $60 off the program. However, we just want to mention that we're going to offer this through the weekend, so through Sunday at midnight. So you've got a few days to sort of poke around and look around and check out all the different stuff that we're going to be offering. And if you just go to Tribe Called V, click the option for the pregnancy program, use the code, you'll get to save $60. And we'd be so excited if you joined our program, because this type of stuff that we're doing tonight it's so clear that, you know, I'm pregnant. I know you go into the doctor's office and you have all these questions you want to ask, and then you get in there and your brain goes blank. And, you know, it's typically kind of a, 15, 20-minute appointment, which is not the doctor's fault. It's just the way it is. I always like to say that so that Shieva doesn't get upset with me, because it's true. The doctors are really, they're so controlled by insurance, and they have to get a certain number of appointments in per day, and they wish that they could spend hours every day, but they can't with each of their patients. And so this is just such a fun, great opportunity to educate yourself, learn a lot more, and be with other women for a fairly low investment. So if you guys have any questions, please let us know. Info@tribecalledv.com is the best email to use. It's all over the website. If you forget,
or on the Instagram site, you can go to Tribe Called V. But yeah, I love, and you guys, the biggest reason we do this is, like, I see in my office every day how people, if I don't catch them before, for example, their big ultrasound, and I forget to say, like, here's some things they might tell you, don't freak out, they come back really nervous. Oh my God, they told me I had cyst in the baby's brain or fluid in the baby's kidneys, or things that sound so concerning. So the book is great because we went through like all the different possibilities and what ifs, but in a way that is meant to be less anxiety provoking, so that you've heard it ahead of time, like Jenny said, preemptively. So I feel like, I don't know, I hope you guys join, because it's so fun. The people who have joined so far, some of whom have been on lives with us, and some of whom are actually like wanting to just email us separately and to have some access to us separately. So it's kind of taken different forms that we didn't even necessarily anticipate. And it's been so great. And actually, I think we're so happy that the kit itself, meaning the components, are great. But I think we were happy that we confirmed what we had hoped and thought, which was that the community aspect seems to be what people are wanting and liking more. So thank you, thank you, thank you. Spread the word, tell your friends, even if they don't want to be part of the program, to just still join us on Instagram, so they can be part of some of these free things. And that's it. If you guys have questions, again, DM us on Tribe Called V on Instagram, or send us a message on info@tribecalledv. Okay.
Yes. And
Thank
thank you. It looks like, I think we are, I can't even see the clock on my computer because of the screen.
I think we are right at 8:30-ish, 8:31.
Look at that. Look at that.
Okay.
We really did it. 8:31.
All right.
So thanks guys.
everybody.
We're so happy that you could join us.
Okay.
Bye.
Do we get to keep all the